Welcome back to The Exam Room, a podcast where we dive deep into the world of value-based care, patient-centered healthcare, and improving health outcomes with your host, Dr. Rhiannon Windsor. Dr. Windsor is a certified surgical technologist, healthcare educator, and the manager of training at VB Care Network. With almost 30 years of experience in healthcare and instructional design, she's spent her career helping clinicians and care teams optimize patient outcomes. When we think about health, we often think about doctors' visits, prescriptions, and procedures. But what if medical care is only a small piece of the puzzle? In this episode of The Exam Room, we're joined by Dr. Mary O'Connor, Chief Medical Officer and co-founder at Vori Health, orthopedic surgeon, former Mayo Clinic and Yale physician, and a national leader in prevention and movement-based health, to challenge the idea that we have a healthcare system at all. This is part one of our conversation on why real health starts in communities, how behavior drives outcomes, and what it will take to move from sick care to true wellness.
When we think about health, most of our systems are built around medical care, right? Appointments, medications, procedures. But research shows that medical care is only a small part of what actually determines whether people stay healthy. The biggest driver of health is individual behavior, how people move, how they manage their pain, do they follow their care plans, and are they staying engaged over time? And yet our healthcare system is largely designed to respond to people after they're already sick, right? Today's conversation takes a step back from that. We're exploring what really contributes to health, why our current system often falls short, and how FQHCs and community health centers can influence individual behavior in ways that are realistic, culturally responsive, and sustainable. Dr. Mary O'Connor is an orthopedic surgeon with more than 2 decades at Mayo Clinic, 5 years at Yale, chair of Movement is Life, and chief medical officer and co-founder of Vori Health. Thank you so much for joining us in the exam room today, Dr. O'Connor. How are you?
I'm great, thank you. Delighted to be with you and your audience.
Thank you so much. We are so excited to have this conversation with you. Now, you've spent your career seeing patients once they're already in pain or crisis, and now you're focused on changing what happens before that point.
Yes.
Can you share how your clinical experience shaped your belief that we don't really have a healthcare system, but a sick care system?
Yeah.
And how that realization led you to focus on behavior, community, and prevention?
Yeah. So, Rihanna, I say that all the time. We don't have a healthcare system. We have a sick care system. And I actually think that that is the system that we should have, that what we call healthcare now is sick care, and we should focus it on sick care. Mm-hmm. And we need to move the concepts of wellness and prevention out of what we call the current healthcare system and into communities, because that's where the magic can happen. And the current healthcare system is not designed to address wellness or prevention, not equipped to do so, and doesn't have the resources or responsibility or authority to do it. Like, for example, a patient comes in and they have knee pain and they're overweight or obese. If that patient were able to lose weight, increase their level of physical activity, their knee pain would significantly improve, and it would be less likely that they would progress to actually needing knee replacement surgery in the future. Okay, medical professionals know this. We can advise the patient, hey, this is what you need to do, because every 10 extra pounds of weight that you carry is another 30 to 60 pounds of pressure on your knees. So it's a huge driver of knee pain and progression of arthritis in your knees. But that individual may live in a food desert. That individual may live in a neighborhood where it's not safe for them to go out and walk in the evening. And I, as a physician, have no ability to impact the fact that they live in a food desert or the fact that their neighborhood is unsafe. right? And what we're seeing is as payment models move towards value-based care with payment being linked to clinical outcomes, which conceptually I favor, I think that that is the direction we should move towards outcome and away from fee for service. But we also have to recognize that when we're holding the clinicians and healthcare systems responsible for these outcomes, there are factors that influence the outcomes for which the healthcare professionals, the doctors, the nurses, the physical therapists, and healthcare systems have no ability to influence. Like, does the patient live in a food desert? Does the patient live in a neighborhood that's unsafe? So it's very complex. But essentially, if we embrace this idea that we're going to focus on wellness and prevention and make them community-based, I think we will make more progress in improving the health of communities and the health of the nation.
Yes, I love that idea of moving this into a more community-based modality. And I want to talk more about behavior change because it's unrealistic of us to think that as healthcare providers and clinicians that we're going to be able to do all the heavy lifting, right? Some of the onus has to be on the patient. And I'm sure it's not easy to hear when a patient comes in and they are having knee pain and you're like, well, you need to lose weight. Like if you lost weight, it would be better. Yeah, the patient probably knows that too, right?
Exactly.
I had a friend in the past who was needing a specific procedure and the surgeon said, well, we're not going to do it until you lose X amount of pounds. And so the person kind of hopscotched from provider to provider till they found someone that said, hey, okay, I'll do it. And then they had a poor outcome. But I think before we can really talk about behavior change, you had shared this little diagram. When you look at the research on what contributes to health, what is something that stands out to you the most?
So I think what stands out to me the most is the relatively small contribution that actual medical care makes to someone's overall health and the relatively large contribution of individual behaviors. Okay, 11% of health outcomes are actually influenced by medical care. However, if you're in a car accident and you fracture your femur or you're having a heart attack or a stroke, like that 11% is absolutely crucial to your outcome.
Yes.
There's a percentage that's influenced by social determinants of health, around 24% or so. That we have the opportunity to impact from a health policy and kind of community-based approach. 22% or so that's influenced by genetics. For that, we have no control, right? We can't, our parents are our parents. But then there's the largest percentage, which you already referenced earlier, of how our individual decisions influence our health. And that is where we have tremendous opportunity. So if you think about in your own life, do I get enough sleep? Do I eat enough fruits and vegetables, right? Am I physically active? Do I exercise? These are all choices that we make every day individually that impact our health. And so part of what we've done at Vori Health, which is the nationwide telemedicine company that I founded along with another surgeon, is we recognize the importance of those behavior changes in helping an individual improve their joint or spine condition. In the traditional medical world of the patient goes to see their primary care doctor and then they're referred to the orthopedic surgeon or they're referred to the spine surgeon, right? Nobody is talking about anti-inflammatory diet, improving sleep, helping the patient improve their level of physical activity. So you can say these things, but we're not giving patients the support or the tools that they need to make the behavior change. And in our model, that's where our health coaches come in. So our health coaches work with our patients and they create SMART goals, which are specific, measurable, actionable, relatable, timely, right? to say, okay, Mary, like you have back pain, and we're going to focus first on improving your sleep. Because if we did nothing for people with low back pain, but improve the quality of their sleep, we would improve their back pain.
Mm-hmm.
Irregardless of whether we gave them physical therapy, we gave them drugs, injections, anything like that. So this is just like one example of how poorly the traditional system focuses on these additional levers that can advance clinical outcomes that are related to personal health behaviors that will also, guess what, help that individual be healthier overall. So my health coach would create a plan with me on kind of the small changes for me to make to build the right habits, right, that are going to result in improved sleep.
Yeah, sleep's a big one. And sometimes you don't even realize, like, I think a lot of people are not aware that they're not getting good sleep until they actually have some good sleep and realize how that, I know there was a time when, like, I had two little dogs and they slept in bed with me at night. I thought that was fine until they weren't there anymore. And I was like, wow, I didn't really realize how much that disrupted my sleep every single night. And that impacts all of our body systems. And I think another thing a lot of patients don't realize, or maybe just people in general, is sometimes I have this all or none thinking where I'm like, oh, if I'm not exercising 6 hours a day and eating a healthy plate every single meal, that I'm just not going to do it at all. It's this all or none thinking, and how important just making small little tweaks and small little changes can really add up over time. It's like that the Kaizen, the Japanese Kaizen, where little bitty steps add up to big changes. And I would guess that underserved communities really feel the consequences more of this sick care model. What are your thoughts about that?
First of all, yes, because underserved communities are burdened with higher adverse social determinants of health, and which of course influences their ability, their options, right, to support healthier lifestyle. Like we mentioned, are they in a food desert? Is it an unsafe neighborhood they can't get outside? The other thing that I think is helpful, and something that I really learned from our work at Movement is Life, which is the nonprofit focused on addressing health disparities in the musculoskeletal space. So we have a community program called Operation Change, focused on women that are 45 years of age or older who have knee pain and other comorbidities. So typically, like, they're overweight or they're obese, they may be diabetic, they have high blood pressure. And so we have these programs that we've done in various cities, 12 weeks in duration. It's 3 hours a session. The first hour is some type of educational program where, we're bringing these 40 women together and we're talking about anti-inflammatory diets, right? Like, what is healthier food to eat, or stress or anxiety, depression, or the importance of physical movement. The second hour is movement based. So that could be, something yoga-ish, or line dancing, or whatever that is. And the third hour, they break into small groups, and it's focused on motivational interviewing, where the women really get down to what are my personal barriers to the behavior change that I need to improve my health, right? I can't control all these social determinants of health. I cannot personally change this, but they can change a lot of their personal decisions. And so the motivational interviewing sessions are really focused on that. And we've seen amazing impact, improvement in their walking speed, weight loss, although it's not a weight loss program. And probably the thing that I found most impactful was a dramatic decrease in their sense of hopelessness. Because these are very, I'll use the term, I don't like the term, but I think people understand the term, marginalized individuals, marginalized women. And they don't have a lot of resources, and they have a lot of stress in their lives. They're caring for an ailing spouse or a sick spouse, or we have women in our program, our rural program. A lot of these women are raising their grandchildren because the parent is in jail on drug trafficking. So, I mean, there's a lot of stuff going on in the lives of these women. So how were the improvements that we saw made? Like, what was it that really was the difference? And it was actually the community. So what it was creating a community for these women so that they could support each other in the behavior change that was needed, and to help hold each other accountable. And that's what we need to create when we go into communities. That's what federally qualified health centers, I think, are uniquely positioned to support. Is we have to start looking at how are we going to support individuals to make these behavior changes. It's the individual behavior change opportunity that we have done so poorly. Okay. And as we focus on that, what are the things that are going to help that individual? It's not just giving them the knowledge of what they can do. Here's options that are better for an anti-inflammatory diet, right? It's also giving them that community that's going to give them the emotional support. And if you think about the other models that use this same concept that work, we don't have to go very far. Look at Alcoholics Anonymous. Look at Weight Watchers. These are all groups that focus on building a community of people that have similar challenges, and I'm going to provide support to them. And we've also aligned our community program operation change based on kind of cultural backgrounds of the women. So we have programs for African American women, we have programs for Latinas, we have programs for rural white women. And why is that? Because, when we want to talk about here's some food that would be helpful for an anti-inflammatory diet, it's not going to be like the Irish Catholic meat and potatoes stuff that I grew up on, right? It's going to be the kinds of foods that they would enjoy eating, that they're used to eating, that they want to cook. Okay, how can we modify those kinds of recipes to make them more anti-inflammatory or substitute different foods? And I'll share just one story and then for this topic. So one of our Latina women at one of our programs in Chicago, she goes home and she starts cooking it for the evening meal, another side dish for her that was healthier. And initially her husband made fun of her for doing it. Like, why are you making this? And she cooked all the regular stuff for him and the children, right? But she's making this other dish for her. And he kind of makes fun of her for doing it. She persists. The children start eating what the other dish that she's making. Then the husband starts eating the other dish that she's making. And the power there is she is the pebble in the pond of improving not just her health, but the health of her entire family. And that's how we can also help change communities.
Thank you for joining us in the exam room, where we examine the vital signs of value-based care and diagnose what's shaping the future of healthcare. We hope this conversation was as insightful as your last checkup. A big thank you to our guests for sharing their expertise and prescribing actionable ideas. Stay tuned for more episodes as we probe the topics that matter most in value-based care. Until next time, take care, and thanks for listening to The Exam Room.